I'm Trevor Riley. Here is a look at the COVID-19 situation at the latest update on April 16th. We had no new confirmed cases, which still sits at 14, and no new deaths, which sit at 1. Total tests done here in the county sit at 875, and we had an increase in negative tests going up to 695, and 166 tests are still awaiting their results. In Ontario, the number of cases went up by 514, bringing it to 8,961. That is a 6% increase from the last report, and 423 deaths have been reported, along with the total testing now reaching over 128,000 as of the 10:30 a.m. update on April 16th. Today, I spoke with Karen Simpson, the administrative lead for the Renfrew County Virtual Triage. She shares with us how things are going along and how it came together with such a short turnaround. Thank you for joining me today. We're going to just talk a little bit about the virtual triage, and I was hoping if you could just give us a little bit of information. It launched on the 27th. Kind of what was the goal behind creating the virtual triage?
Right. So there were a number of goals. The first thing that we were considering is setting up an assessment center for Renfrew County, and that's obviously as a result of the pandemic and COVID-19. With that assessment, we looked at the fact that Renfrew County is one of the largest counties in the province. So from a geography perspective, it really didn't work to have physical assessment centers. You would have had to have many of those across the county to be able to serve the needs. The other issue that we were also looking at was we really didn't want to bring people to a physical site, because obviously you want people to stay at home. You want, if they're sick, to be at home and being supported there, as opposed to going out in the public. And then the final piece was we were really working hard to look at why people were going to emergency rooms across the county and trying to keep those individuals out of those emergency rooms if they didn't need to be there. And as you probably know, that in Renfrew County, we have a significant number of patients across the county who are not rostered to family physicians. So they don't have a family physician, or they weren't able to reach a family physician. So as a result of that, working with the chief of paramedics, Eric Hanna from the Arm Prairie Regional Health, our Dr. Fitzsimon, one of our family physicians, other family physicians across the county and hospitals, we came up with the concept of the Virtual Triage and Assessment Center. And it launched, as you know, on March the 28th, I believe it was. And as of now, we've served well over 1,500 people with assessments for primary care needs and COVID-related needs through that endeavor.
It's a fantastic program. I think it's something that's definitely going to change healthcare, definitely, in Renfrew County. Now, you guys passed a significant milestone, pulling a positive out of this in this whole situation. Could you talk a little bit about how many people you guys have been able to assess?
Yeah, no, for sure. So as I say, it's been well over 1,500 people, which is broken down. So about 1,400 of those were actually in person, over the phone, virtually, or virtual visits through video technology, visits with patients, with physicians. Plus, there's an additional over 300 visits that have been done in home with the patients by the community paramedics. So the paramedics are referred by the VTAC line physicians where there's an identification that they need to be assessed in the home, either for COVID-related needs, e.g. a swab, or they have other health concerns that really need sort of a hands-on or eyes-on view by the paramedics. So of those over 300 visits in the home, almost 300 of those, so it's about 280 of those have been for actually COVID swabs. But in addition, there are some people who've also been seen for other health concerns. So what we're seeing is just an example. Yesterday, we had 83 appointments with physicians specifically, and 24 in-home assessments by paramedics. So it just gives you a sense of the volume of information, volume of patients that we're seeing through VTAC. We also have a group of physicians that are set up under Dr. Radke out of Renfrew to work with patients who are in their home being monitored through remote monitoring systems through the paramedics. And so it's really, VTAC has created a hub with lots of different arms to make sure the needs of patients and residents across Renfrew County are being met. So it's exciting because it's collaborative. We have extensive partnerships that have developed. And to date, of all those people that we've been seeing through VTAC, only one person was transferred to hospital. So the goal of keeping people out of hospitals is being achieved, and we're excited to see that happen because hopefully that will keep the number of people being impacted by COVID in Renfrew County to as minimal a number as possible.
Welcome back. VTAC was created to help deal with all types of medical issues, not just COVID-19. I asked Karen, besides the regular medical calls, what has been the impact from COVID-19? The numbers in relation to COVID-19 patients, is there a percentage? Is there is it a mix? Is it kind of all over the place?
So about 25% of the calls that we get result in an in-home assessment by the paramedics, and about 80% of those there's a COVID-19 swab done. Now, many of those are coming back negative, which is the good news, right? So there aren't a lot of those coming back positive, but obviously that's part of the surveillance that public health. So public health is very much a partner in everything we're doing. So we work with Dr. Cushman, who's the medical officer of health, to ensure that we're meeting all the needs of the public health as well. And the goal obviously is to keep those numbers as low as we can and work with the community that way.
Now, Renfrew County displays a lot of different challenges just in the vast area. What kind of setting this up and getting it logistically to work? What were a couple of the challenges or a few of the challenges that you guys had to face and overcome?
So, we had a lot of support. I just want to recognize Canadian Nuclear Labs, who provided us with some IT support to get our virtual visiting technology set up. We had the Canadian Patient Safety Institute, who volunteered one of their staff members to help us. So a number of people who've come forward. 211, who actually set up the telephone software for us to be able to man the 1-800 number, which is a great program and is working really, really well for us. So I think, yes, getting the technology set up was certainly a challenge, but we've been able to make it happen through the support of all those other groups. I think the other piece is just the speed with which we had to do this. So we literally got the go-ahead to make this go from Ontario Health on March the 20th. We had a soft launch on March the 26th or 7th, and we had the help of Algonquin College students who pretended to be patients and phoned in and tested the system, so thanks to them as well. And then we launched on the Friday, and it's been a going concern since then. It's been extremely busy, but we couldn't have done it without the support of the other primary care family health teams, the community health center, the physicians, the hospitals, the long-term care, paramedics, everybody who's really worked together. It's been an incredible collaborative initiative, and we're seeing positive results as a result of that.
It's an amazing. It's amazing how something like this, as negative and horrible as it is, it's really bringing all these different groups together, and it's amazing all the different hands that are making it work. I guess what eventually, I don't know when this whole COVID-19 thing will settle down, but what is the future of the triage, of the virtual triage in Renfrew County?
Yeah, and I think it's early to say, who knows what the future will hold. I think what we're able to do, though, through the Virtual Triage and Assessment Center is demonstrate that there's a model that can be incorporated within primary care settings to support the primary care needs of patients out in the community. It doesn't encompass everything. You still need that hands-on face-to-face ability to see patients in certain circumstances, which of course is difficult at this point. But we've been able to demonstrate that a lot of the needs we can actually address through this system. And I think there's a place for it down the road. It's forced us into a new world, a new technology that maybe we hadn't adopted in the past, that now we're using for this center, and it's working. And yes, we can improve, and yes, there will be learnings from it, but you know what? It's a step in the right direction.
And I guess really quickly to wrap it up, how can people get a hold of this if they haven't? I mean, the number's been everywhere, but if someone's watching this and they're interested, or they know somebody who could really use this right now, how do they contact the assessment center?
So we have a 1-800 number. It's 1-844-727-6404. And what I would say to people is you may be in the queue. We're trying to get to people very quickly. It's not really a long wait, usually no more than 10 minutes. And we set you up with a physician appointment for the physician to call you. And just hang on. And if anything happens with your call, just call us back and we'll respond.
Karen, thank you for joining me today to talk about the virtual triage. Hopefully we can get back in touch with you in hopefully a couple of weeks when things have settled down a little bit, and we can get another update to see maybe where the future of this virtual triage will be heading in the post-COVID, whenever that is happening. So thank you for joining me today.
You're very welcome. I'm happy to do it.
Remember to stay up to date and visit yourtv.tv for all our COVID-19 coverage. I'm Trevor Riley. Thanks for watching.